putting my sterile gloves on. I'll just take a second. Okay. And you can choose to chat with them. I prefer just to get the work done so I can do this. I'm right-handed, so this works for me. If you're left-handed, you would have to adjust what makes sense. I want to be able to take my things and hold her, have my deposit there, and if she's uncomfortable, I can do that. Okay. This I'm just going to leave. Now I'm all sterile. Some people don't use this, but we teach you guys to do it. What you do want to do is protect your gloves though, so if I'm going to be anywhere near her gown or anything, just put that there. And if that stays, great. If it doesn't, it just provides me with a little extra. Okay, so now I have my kit, and I'm just going to be mindful of my sterile procedures. So open that, drop. Here's my balloon. I'm going to just attach this, drop, and have this on the top. I think I'm going to choose to take this off. The good way to take this off is pull, but always have control of your catheter. Again, just drop. Don't want to get too close to when I drop things. Just going to go in. Okay, sterile is going to stay, and lube is going to squirt. Just drop that anywhere, and I am ready to go. So now I want to put this on top, carry it as one unit. Really, it did not take very long to do that. I have my lube over here, and I'm right-handed, so I'm going to grab, insert in lube, and then go. And I want to be careful I'm not touching her legs as I go in, so kind of your gloves sort of knife-like. Okay, Jane, I'm going to touch your bottom. It's going to be cold with that iodine, okay? I did ask her about shellfish or iodine allergies, and so I'm just resting my hand on the sterile, thumb and forefinger open. Here we go. It's going to be cold, and they give you plenty of these, so right, left, down. So I'm going to go this way. Just drop. Don't go inside that at all. And left, go this way, drop. And they give you extra. You don't have to use them. And then center, down, drop. Just let that go too. Here's my catheter. I want to hold it about here so I have lots of control. Lube it up. I've lubed up about 4 inches or so. My hands are going to be sticky. Here we go, Jane. Nice, easy breath and relax. Mannequins, of course, have perfect anatomy. This is really hard. My head would literally have to be down a little bit. And in we go. So it's going to feel a little pressure. And it might be just try to not force, but just nice, gentle. The syringe is going to catch. Just be aware of that and keep pulling it. I should see urine. The mannequins don't see urine, but you should be within, 3 to 4 inches. I'm about 3 inches from her labia. Now I'm holding it with this hand. I have to let go here. So I'm gonna, if I feel any force or she starts screaming in pain, I would stop because I'm not all the way in. So it should just feel nice, easy. She shouldn't feel anything. Okay, so in. Now I'm just gonna pull back just a little. Feel a little resistance. I'm in. 2 hands to take this back. Done. I'll just drop it, and now I can, if my hands are all sticky, I could wipe them off, get rid of this, because I have to touch that bag. I could also, before I get rid of that, clean her up, remove my gloves, touch the bag. Okay. Okay, Jane, now I've changed my gloves so I don't contaminate this, and I'm going to set that down. I should be seeing urine at this time. Are you feeling some relief? Okay, great. So we'll put this lower than the bed. Okay. I would put the leg strap on and then have it so it's nice and relaxed. Okay, and Jane, before I leave you today then, new gloves, I'm going to get a sample. So in order to get a sample, I only want fresh urine. Can you see okay? So Jane, you can just relax your legs now. Good. If I needed to, I could get this stuff out of the way. I'm going to leave that draped because oftentimes you have to get a sample right away. And I kept that covered. Okay, Jane, are you okay? I have my sample. I'm not going to step away from her. Just pull my other supplies closer. And for my sample, I'm going to have a sterile syringe, alcohol wipe, and whatever the lab asked for. So the lab needed 30 mils at a 30 ml syringe. Okay, and I need to clamp it. She clearly has fresh urine. If there wasn't any urine, I could clamp it like this and hold it. I could also use this little green piece here and just put that in, and that will hold it for a few minutes. Okay, never would want to leave her with that in there. Okay, so I'm seeing fresh urine coming. Strap that. So I have my sterile syringe. Scrub the top. You could go 30 seconds. There's no number for this. Scrub and around because it locks it. Scrub, scrub, scrub. Drop. Take my syringe very carefully. Push it on, and you're going to feel some resistance. So you're going to really push it on until it's locked. So it's that lure lock in place. Good. Okay, Jane, you won't feel any pressure at all. I'm just pulling from your bladder. Nice and easy. I'm only getting, 35 what I need. Undo. Now I'm going to unclamp just so she's comfortable. Now if I didn't undo this first, then I could take it off and just be very mindful of that sterile technique. The lid, and it goes. Done with that. Easy does it. I have that label in here. Clean this all off. New gloves label, lab sample bag. Okay, so that's insert. Got a sample, and then say it's been several days. We'll take that off, and for some reason I don't see any urine in the bag. Okay, if that were the case, then the physician would order irrigation. So I would do the exact same thing, but in this case I would have whatever the irrigant is. Most times it's saline, so I'd pour saline in here. I would not use that syringe because I still need to use the Lure-Lock syringe. The syringe that comes with this is too big. It doesn't have a holder, so that just stays. Okay, so I have a sterile syringe, and I would withdraw as much of the saline as was asked for. So the purpose for this is that it's not draining, so I need to flush the catheter. There's probably a clog in the catheter. Flush and then let it come out. Flush, come out. It's a series, and we look at the return. So I have that sterile flush, and there is my catheter. This time I want to, again, clamp it because I don't want to flush down there. I already know there's a block in here. So if I didn't clamp it, it would just go down to the bag. So I don't want to do that. Notice the whole time I've kept my syringe sterile. Okay, so now I'm just going to open, strap that, using that blue port, not the balloon. Scrub, 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 scrub around. This is just clean technique. Again, Jane, shouldn't feel any pressure at all. So push it on. Leave that clamp on, and now I'm pushing the irrigant toward the bladder. So I should see movement. Okay, take it off, open. It's the exact same procedure. This time I'm just pushing and then watch for returns. If I needed to do it again, then you just repeat it, being mindful, keeping your ends sterile. Clamp, new alcohol wipe, and Jane, one more time. So the procedure is the same whether I'm irrigating it or getting a sample. So this time I'll just show you how to do it, pinching it, just pinching it, pushing fluid toward the bladder, unpinching it, take this off, look for returns. The order will be to continue until it's clear. Okay, we'll say it's clear. It's been several days. Okay, Jane, it's time to remove your catheter. So the last skill, so we inserted, we got a sample, we irrigated, and now we are going to remove your catheter. So you need a 10 ml syringe. Any 10 ml syringe will do. And we're going to attach it here. We're going to put a padding down on the bed. Make sure we have something to clean her up with. Okay, Jane, I'm just going to withdraw the fluid in the balloon. You shouldn't feel anything at all. Be great to get this catheter out now, won't it? Okay. And you get as much as possible. Let it drain and then take it out. Okay, and now Jane, nice deep breath and let it go. And it's usually 2 hands. Ready? 1, 2, 3, out. Good job. Wrap it up in this, wipe off, care for her. Okay. Any questions about that?